Hello and good evening, everyone. My name is Dr. Laura Varden. I am Dean of the DNA University and an in-house clinician here at the DNA Company. And we are going to be talking about a topic that can be somewhat controversial, but very important. And that is about vaccines. But more specifically, what we're going to be discussing is how genetics can affect vaccine response and giving a little bit of a background on some information. Not going to be diving into any political aspects of it, but about the science, about the medical aspects. And with me tonight, I have the great honor and pleasure of having our own Chief Medical Officer, Dr. Boyce Burkle. Just to let you know, he is traveling at the moment, so the background can be a little off. So just try to bear with us with the technical issues, but the brilliance and his long experience will definitely outshine that. So hello and welcome, Dr. Burkle. How are you this evening?
Well, I'm fine, and thank you very much, and welcome to everyone who has joined us.
Excellent. And please, if you haven't taken the chance yet, please fill out the poll that we have. We will be going over that shortly, and that really provides us some fantastic information on what you know, what you want to know, what you really want to take away from this webinar. So with that being said, we really want to make sure that as we are covering this information that we're going to be speaking with you tonight, that our purpose is not a for or against vaccines, okay? It's so much more nuanced. And we are really looking at evidence-based conversations, really looking at the science, looking at, what we know and what we have learned even in the last 5 years. The fact is that yes, vaccines can prevent severe disease, disability, and death, but yes, they can also cause real harms and injuries that can occur, especially in susceptible individuals. And this is where we here at the DNA Company looking at functional genomics, looking at your genetics through a functional lens that are clinically relevant, that are actionable, saying, where can your susceptibilities lie? Where are your weak points that could give you more information to say, maybe I need to think about this. If you have an upcoming vaccine or something that you're looking to get, we are not saying get it or don't get it. That's your decision. We just want to make sure that you are fully informed as best as possible, so you are making the best, most healthy decision for you, for your family. So, Dr. Burkle, can you please tell our audience a little bit about yourself before we start diving into how we can say, oh, we've got some authority on being able to talk about all this. Can you please tell them a little bit about who you are and what you do?
Yeah, my name is Dr. Boyce Burkle. I am a surgeon by training, emergency physician by profession. But over the last several years, I've delved into the metabolic management of health. And so before we start, I'd like to kind of get your mind looking at this subject in a way that maybe was really not intended here, and maybe you have not thought about. But we have to look at health as a partnership. There's the medical profession, there's the society around us, and there's us ourselves. Okay? So in factoring any decisions we make, we have to think of its impact. We have to think of what we can learn from the medical profession. We have to think of the impact society may have around us. But those things we really don't have much control. We have control over ourselves. So we need to be doing the things to keep ourselves as healthy as possible, get all the information we can, We heard about DNA variants. We heard about those kinds of things. But the things we need to do to keep our system healthy. So even though we get the vaccine and there's a potential for an adverse event, if that vaccine goes into someone who is compromised, that increases that risk of that adverse event in that particular context. Where if that person is healthy in terms of his immune system, in terms of his overall metabolic state, then that in itself should minimize the impact of an adverse event. And not only that, but promote the system's response to the vaccine in the first place in terms of helping us to develop the immunity that we're trying to develop. So if we think in those terms, then our primary goal is to be as healthy as possible, do the things we need to do to be healthy, have a strong immune system. And then once we do that, then we begin looking at vaccines. Now, vaccines have their place, and they've always had their place since they've been discovered. And over the years, we know that smallpox, we know that measles, we know that HPV vaccines, we know that all those things have had their impact in minimizing and preventing illness and death, especially in children and obviously in adults as well. So there is a place for vaccines. The place that we have to be is, how do I approach it? How do I make the decisions related to the particular vaccine? And then we have to make those decisions in the light of not necessarily vaccine as a universal vaccine, but each vaccine has its own distinct variances. And so we have to factor all those things in terms of how we make the decision for or against that particular vaccine.
All right. And thank you for that wonderful information. And we're going to be diving into a little bit more of that in just a moment. But I really would like to go over the poll questions, the answers given. So, Vanny, if you, excuse me, if you can bring that up. Thank you. She's quick on the draw. Good job. All right. So, based on our poll, a lot of you actually, almost half of you have said that vaccines have benefits and risks. That really followed up by not being so certain or having concerns about vaccine safety, where much fewer of you say that, yeah, mostly they're beneficial or they're entirely beneficial with minimal downsides. That was followed up by our next question about familiarity, about adverse events. And this really was, again, kind of scattered throughout basically the same percentages, that about 40% somewhat familiar about adverse events, 36% of you said very familiar. I would be interested in knowing if you yourself have had an adverse event, or if you personally know someone who have had an adverse event, where a much smaller percent said that you've heard of them, don't really know the details, or that you really don't know anything about vaccine adverse events. When we talk about and asked to the extent of which what your belief is of genetic influence on vaccine response. And here we really have quite a spread going through that, again, around that 40% have major influence, a smaller percent saying a moderate influence, and just about the same amount saying that you really don't know, that you've never really considered it. So I'm hoping that as we walk through this webinar tonight, I'll be bringing up a lot of different genetics, pathways that can influence the way that you could respond to a vaccine. Unfortunately, there's not a lot of research, robust research. It really is a burning field, which I'm going to be talking about a little bit later. When we're talking about genetics and that connection to vaccines, because when we really think about it, genetics is still a pretty young field, and it is just the information, the research is absolutely blowing up, because people are realizing, and the medical society is realizing, that genetics is very important when it comes to personalized medicine, because it's not a one size fits all. And that's the same kind of thing that vaccines can fit into, that everyone's getting the same amount. I mean, obviously, children having a certain amount, adults getting a certain amount, but it almost can feel like it's a one size fits all. And this is where we want to come in and say, well, but our bodies are not, our genetics are not. So these are the nuances that you want to know about to be better informed, for your own medical freedom of choice, to say, yes, I want it. Maybe I want to think about it, or no, I don't. So thankfully, we do live in a country where we can have that choice. So for our fourth question, we were really talking about vaccine decisions. What factors feel most important to you? And overwhelmingly, you all said individual level safety. And that's exactly where knowing your DNA and knowing functional genomics comes into play. And then it was, the rest was spread out between the other choices. Our last question, really about increasing your confidence when it comes to vaccine safety. What's most important to you for that? And more than half of you said better data on individual risk factors. Just as in genetics. Again, that personalized medicine, this is important to you, to your family. So where secondarily, most of you wanted transparency about the risks. Absolutely. We do need to have clear communication, open communication, where we can all talk openly and have discussions. And that means, not always agreeing, and that's okay. That's what medicine, that's what science is all about. So thank you very much for answering those poll questions. We truly appreciate it. And Dr. Burkle, I'm going to hand it back over to you. If you wanted to talk about or mention any other information about vaccines, things that you would have when you were talking about population level, herd immunity, anything like that. Did you have any last words for that before I start jumping into other aspects about what vaccine risks, harms, what are they? How do we detect them? Did you have anything else to add?
Not so much than what I've said already. You mentioned herd immunity. All those things play a role, and over the years we've seen herd immunity come into play. In fact, we've seen a lot of good come out of vaccines in terms of populations, in terms of third world countries, in terms of developed countries. We've seen reductions. I mentioned a few things: the measles, the chicken pox. Those things used to cause significant morbidity and mortality. Lots of encephalitis, pneumonia, those kinds of things. Not only that, in thinking of vaccines, we got to think of vaccines, and some of them need to be repeated and reinforced. So again, we have to factor those things in terms of our decision making. So there is a lot of benefit to vaccines, but like everything else, we don't live in a perfect world. And so the more we know, the better decisions we can make. And the more we know
Absolutely.
about ourselves, the more we know about the vaccines, the more we know about the adverse reactions, the better decision we can make. So it boils down to knowledge and understanding in order to make informed decisions.
Well, thank you, definitely. And, that's really where it comes is being informed. And we're going to state that again, being informed, doing your own homework, digging in. And when you consider that this comes down to your health, you have to weigh out the pros and cons, any type of risks over the rewards, because nothing, there's no vaccine that is 100% safe. This has been stated. It's not me saying this. This is what the pharmaceutical companies have said themselves. Anytime you've ever looked in an insert, potential adverse reactions, risks, and there's a list of different types of adverse reactions that can occur. They don't just arbitrarily throw a bunch of things in there. That's not how that works. They do that based on their research, on what they're doing, on their clinical trials. They put those things in there. They have to. If they don't put something in there that is a potential risk or is a risk factor, then there's legal responsibility. And the fact is that pharmaceutical companies, because vaccines are considered biologics, not medication, they are not legally responsible if you do have an adverse reaction. And this is just the way it is. And so when you're talking about, for adverse reactions, I mean, this is kind of like opening up a whole Pandora's box of how the process works. But if you do have an adverse reaction, you actually have to go through a national vaccine injury compensation program. And all of this information is on the government website through the Health Resources and Services Administration. The things that I am saying are available on these governmental CDC website, coming right from CDC, also from the pharmaceutical companies that create these vaccines. So, talking about adverse reactions. Now, what exactly does that mean? So, in strict medical and legal sense, a vaccine injury is an adverse health outcome that's judged more likely than not to have been caused or significantly triggered by a vaccine. And often they use criteria like timing, biological plausibility, exclusion of other causes, and sometimes compensation program standards. Like I said, that US Vaccine Injury Compensation Program actually has a table that they use. So that's how they determine, when you are going through, if you do believe that you have had an adverse reaction from a vaccine, that's how you go through that process. So that's really, when we're talking about adverse reactions, that's the definition of it. Okay. But when we're talking about the types, so if we're saying common or mild, well, common, mild, yeah, when you get an injection, you could have a sore arm, low-grade fever, fatigue, different things. Those are somewhat expected. When we're talking about less common or more clinically important adverse reactions, we're talking about things like anaphylaxis. We're talking about immune-mediated events, basically your immune system being overreacted, okay? Different conditions like myocarditis, Guillain-Barré, even Bell's palsy. So a lot of these different events can happen typically. Honestly, it's kind of difficult to know exactly when the onset can be because it does vary. But if you have or notice these types of symptoms and it's around the time that you have a vaccine, please make sure to go to your doctor, because when you do, they are supposed to be filing a report with VAERS. It's a vaccine adverse reaction reporting system. And that is the system that is set up by our government to let us know, or to let them know, that there is a possible adverse reaction and they're supposed to follow up, and there's a whole process. So that's the system. Is it the best system? Is it, a well working, functioning system? Well, that's debatable. There actually was a study that was done on that through the Harvard Health System, and they found that roughly that it only captured about 1 to at most 10% of adverse reactions. That's not me saying that, that's them saying that. That is a report that they submitted to the government. So it's not, I wouldn't say, and this is my opinion, I wouldn't say that it's the best system, but it's a system. And then there is another capture system with COVID-19. So that's a whole other Pandora's box that it's not a matter of really diving into all of that. But for that particular system, it's the vSafe. And so that was an app that people, could decide to go in on if they got the COVID vaccine shot. And with that, there were over 10 million people who decided to put in the information into that system. So that vSafe, and it is through, and you can get this information through CDC from their data, but there's also on a site, icandecide.org actually took all of CDC's data and put it in a system where you can actually see the numbers. And all of this information is all, through the legal system that they acquired this and they put it in so that way you can actually take a look. So when you are talking about, over 10 million individuals who put in information, and through that, there were 6.4 million people who had health impacts that reported that. So when you consider rare, not rare, well, look at the numbers yourself and you decide. But knowing where this information lies, and for you to go in and do homework, that's the important thing. So again, I don't want to stay mired in that type of debate. What I would like to stay focused on is the fact that genetics play a factor. And how do you, the consumer, the client, the patient, who's possibly getting a vaccine, who may have had a vaccine, what can we do about it? It's like, let's get to brass tacks. Let's say, okay, I've got my DNA. What do I need to look for? What do I need to understand to know my susceptibility, so I can make a better informed decision? So before I jump into that, I wanted to ask Dr. Burkle, do you have any information, any takeaways, any comments about adverse events, anything about licensure, anything about the vaccines themselves that you wanted to provide based on what I have given?
Yeah. Well, you did a good job of laying that out there. If I've been around long enough to have seen adverse events in real life, and some of them are pretty adverse if we leave it at that. So they do happen, obviously, and once we are aware and we do our due diligence and we make the decision, again, as I said earlier, we don't live in a perfect world, and no matter what we do, it's like getting in your car, putting your seatbelt on. someone may still run a red light, and you may find yourself in a lot of trouble. So you still have to put that seatbelt on. You still have to drive defensively. You still have to do the things that are in your power to do to minimize or to get you a safe ride from where you are to where you're trying to go. So it is with health. You want to do the things to get you a safe ride from where you are to where you want to go in terms of maintaining your health. And so you do the homework we've been talking about. But there's always that potential of risk of, I don't have it in my head, but let me go down a short list here and give you an idea of certain vaccines and the failure rate of those vaccines for whatever reason. Okay, so I said mumps. Measles, it's been around a long time. It's proven itself, and there's a 3% failure rate in terms of someone getting the vaccine and still getting measles, because that is something that we have to think about. And we may not put that in the classification of an adverse event, but we did not achieve what we were trying to do. Mumps, there's a 12% failure rate if we think of it in those terms. Influenza, there's a 40 to 80% failure rate. And those are numbers that we need to pay attention to and we need to know, because we may not get an adverse reaction from the vaccine itself, but if down the road there's a 40 to 80% chance that it's not going to work for me, then we have to factor that in as well. Going down the list, hepatitis A, hepatitis B, those things have been around. They've proven themselves 0 to 5% that they may not work for you. Things like COVID, there again, we're getting into the 40 to 80%. Not adverse reaction in terms of that. We saw the adverse reaction on that pretty high in terms of maybe 60% or so. But the fact of it not working, that is not an adverse reaction, but that's certainly not what we had in mind when we went in to get our vaccine. So all those are factors that we need to be aware of. We need to factor into our decision making, and then we can make a better choice, a better decision as to if not.
And something else that I wanted to mention, and I mentioned it a little bit before, when it comes to the pharmaceutical companies, again, vaccines are not considered in prescription medications. Okay, it's in a different category. It's under biologics, so it is legally dealt with differently, and they are totally removed from legal liability if someone is injured. And the interesting thing is that, with all of the vaccines, sans COVID-19, because that was the first one where they actually used a placebo meaning like a sugar water, not another vaccine, but all of the vaccines in the childhood vaccine schedule, none of them have a control or a placebo, any type of placebo control. And that's not me just saying that, that is a fact. Also, when you're talking about safety review after injection, very short periods of time. Unfortunately, there are adverse reactions and issues that can come up, several months, years later. A lot of the vaccines, we're talking 5 days for Hep B, 30 days for the DTaP, 6 months for the PCV, 30 days, 3 days and 30 days for the Hib. For the flu shot, they don't really have any major, that changes annually. But a lot of these, they don't go more than 6 months. Is that enough time to know an adverse reaction? I don't know. I can just tell you these are facts, and these can be looked up, within the pharmaceuticals, their information. This is available. It's actually in a chart I just put the link in the chat so you can take a look with links to the package inserts. Again, this is someone just saying it. This is factual information from the pharmaceutical companies, from what they show. So just taking, what we have, and then you decide. But it should, again, just give you a moment of pause, to be able to assess the situation. So I want to move on to now diving into some of the genetics aspect, because I think that this is really where the rubber meets the road. This is the important information. And from that, there has been research that has been done because it's a wonderful thing how science starts moving, that there is a new area of study that is called Vaccinomics or Adversomics. So what this is, this work specifically focuses on genetics and systems biology as predictors of vaccine adverse reactions, including rare events like autoimmune pneumonia, myocarditis, pericarditis, neurological syndromes, all of these things. And there was actually some recent GWAS, which is a particular type of genetic-wide search on post-COVID-19 vaccine, myocarditis, pericarditis, pointing to immune and inflammatory genetics areas of the genes that suggest autoimmune-like situations or events where, hey, this could, cause people to have higher reactivity or a stronger adverse event. So with this, let's look at some of the genes. So when we're talking about clinical risk stratification, for vaccine adverse events, it still relies primarily on prior severe reactions, allergies, autoimmune history, doing these types of things. So there was some research, and actually, Dr. Burkle, are you familiar with the research that was done on the HLA genes for the adverse reaction?
No, but if you can help us with that.
Sure, absolutely. All right. So in this, what ended up happening is that it was actually here, let me just bring up the things, because I just moved off of it and I want to make sure that I have. Well, in any case, basically the HLA genes, and yes, these are the ones that you will find in the diet and nutrition report when we're talking about carbohydrates, because in our reports, we refer to them when in regards to gluten sensitivity, celiac sensitivity. And with that, those genes have actually been associated with influencing antigen presentation, autoimmunity risk, and vaccine immunogenicity. So this is meaning that your immune system being overreactive in an autoimmune fashion due to the vaccine. So specific HLA class alleles, the DQ haplotypes, and I know this is a lot of scientific language, basically the HLA genes that we report on have and can alter antibody response with certain vaccine-linked autoimmune phenomena. And this Adversomics that I was talking about, it looks at these genes and treats it for that susceptibility if you have dysregulation in those genes. Another particular One is when we're talking about one carbon genes or folate. Okay, so we're talking about the methylation pathway. So the methylation pathway has been associated with adverse events after things like smallpox vaccinations, likely through impacts of methylation or the redox reaction. Okay, and so this affects immune regulation. So the methylation pathway being very important when we are talking about, detoxification, that has been looked at in research for vaccine effects or possibility of having a stronger risk or adverse reaction. And that really goes into looking at your detoxification pathways. So there was actually a paper that looked at, what was it? The GST genes. So for the GST genes, now these are your GST-T1, GST-M1, and GST-P1. So this is the glutathione conjugation pathway. And that, along with your antioxidation pathway, SOD2, GPX, these genotypes are very important because they help with the detoxification of the body. They help with antioxidation, and these genotypes are repeatedly linked to higher oxidative stress load, worse outcomes when we're talking about inflammation or inflammatory or infectious states, including things like COVID-19. And this can actually cause greater tissue injury if you have higher reactive oxygen species, a higher oxidative stress load, that you can have, again, that higher tissue injury. And some of the research that they've looked at the GST genes when you have null variants, that your glutathione conjugation pathway is not as strong. It is not as present for that. Maybe if your antioxidation pathway, if you're not removing that oxidative stress as well, this increases inflammation, because a lot of these problems are associated with higher inflammation. Is that what you have found, Dr. Burkle, as far as incidences where you said you've seen adverse reactions, correct, in your patients? What types of markers or things have you noticed? If you found that their inflammatory markers were higher, or different types of presentations, maybe even gut dysbiosis. Have you noticed that? Can you speak to that, please?
Yeah, various organs, various systems are affected. Neurologically, we've seen issues associated with that in terms of adverse reaction. Gastrointestinal, of course. Joint issues in terms of adverse reactions. Obviously, the allergic reactions that we see. We don't, at least in my role, we don't go specifically into details in terms of specific cause in terms of that reaction, but we've seen them in terms of the various organs being affected, and in terms of and making that association. It's hard to make that association because sometimes, sometimes we see reactions that are immediate. There are two later, well, you factor in, well, this was not an issue before the vaccination, it's an issue now. So there is a cause and effect relationship. We factored that in. So those are the kinds of things, those are the kinds of things we see or have seen over the years in terms of adverse reaction to vaccines.
So some other genes that can be impactful. Now, I will say that since the science, the research is not as robust, like I had mentioned previously, this is a new field that is being looked into, that is being tested, and it takes time. As a researcher myself working in the lab, uh, it can take years to have this done. So it's not as easy to see a bunch of work out there unless there are more scientists, more universities that are studying and looking into this. And hopefully now we are getting more interest in this field, in this area of study of vaccinomics or adversomics. So a lot of the other genes. Like I said, there has been published research on the HLA genes in relationship to vaccines for the GST genes. Okay. Also, that is published. But for a lot of the others, there's not a lot of direct research in these adverse events following immunization. And these GWAS are genetic signals that have actually been studied. But there's still an aspect of a strong immune system, of looking at how the immune system can be compromised through vaccination. The whole point of a vaccine is to incite the immune system. We want to bring something foreign to it. And that's where adjuvants, okay, adjuvants being something that is not good for the body necessarily. It incites it. It says, immune system, this is foreign. I want you to notice it and create antibodies. I want you to create an immune response. And adjuvants make that immune response bigger. So adjuvants, things like aluminum has been used, mercury used to be used. They've actually taken that out of the children's vaccines. They do still periodically use it in the influenza vaccine. But I know the last time that I had checked, that was back in 2019. So I'm not sure if they have totally removed that. But again, they put something in there to get a bigger response from the vaccine itself. And there's a lot of different ingredients that are also used. So again, that can open up a whole other, discussion, Pandora's box. But I really want to stay focused more on the genetics aspect. So just to let you know that for some of these other genes that I'm going to be talking about, they are more informed based on the fact that inflammation is a big problem. Autoimmunity is a big problem. Also, how we perceive the pain, these signals, when we're talking about the neurotransmitters, dopamine, serotonin, stress reactivity, pain perception, all of these affect our responses to these noxious things, from the vaccines. So functionally, we want to look at things like, how is your BDNF, brain-derived neurotrophic factor? How is your dopamine receptors, the DRD2? How are you transporting, making serotonin with the TPH2 or transporting it with the 5-HTTLPR? How well do you clear these neurotransmitters, the COMT, the MAO? All of these determine the plasticity, how your brain is reacting and reading this information and what is going on in your body. And when you're talking about your working memory, stress linked patterns of these neurotransmitters, and that could plausibly influence recovery from any immune triggered neuroinflammatory insult. That aluminum, like I said, aluminum is used as an adjuvant. Aluminum is a neurotoxin. So, anytime also, there has been evidence that the gut biome is affected when, for people who have had vaccine adverse events. And I mean, this is not just saying, oh, they think it is. No, this, that yes, they have, but their guts have been disrupted. So we have to understand that, well, your gut is your immune system for the most part, and the gut biome that is affecting inflammatory markers, the information to your brain. Generally, if you have a leaky brain or a dysregulated gut, it's going to be affecting the brain as well, because the gut bacteria, those postbiotics, those metabolites that the gut bacteria create, they directly affect the brain. They affect other aspects of the body, like butyrate. Okay, that's a major small chain fatty acid that is produced by things like Firmicutes and the Bacteroidetes. Very, very important. But if they are dysregulated, well, that whole system is going to be dysregulated. Other genes that you can take a look at that could affect are things like your clock gene, your cry1 gene. And these deal with circadian rhythm, because variants in these genes can change, can adjust your circadian timing, your sleep architecture. And given strong circadian control over the innate and adaptive responses, your immune system, they can actually alter when and how any type of reactions you have could manifest. And again, this is a mechanistic inference. What I mean by that is that I don't have the direct connection, the research evidence for it, but this is taking the knowledge that we have, some other knowledge that we have, and seeing how they come together and how they can affect or influence one another. So just to, reiterate this, now what I have been saying, with like the BDNF, the neurotransmitters, the clock, the cry, all of these genes, this is not supported by dedicated vaccine studies. Not yet. I'm hoping this will, promote scientists and research in that. So there are actually, I want to take a look. So we've got some good questions coming in. We are going to be jumping over to our questions shortly. I just wanted to touch on a few other genes and then get some last insights from Dr. Burkle on any other information you wanted to share. But I would also say different genes that you want to look at. You should look at your cardiometabolic, your vascular, lipid genes, okay? The blood, very, very important. How sensitive is your endothelial lining of your vasculature to inflammation? Remember what we're talking about. These things travel. Inflammatory cytokines, they travel through our bloodstream. So how sensitive are you to inflammation? That's also something that you want to take a look at through your genetics, through your reports. And when we're looking at the Adversomics literature, so far it really has focused mostly on immune and redox genetics, okay, and areas of the genes where that focus on the immune system and redox reactions. So again, we are talking about like the methylation pathway, detox pathways, your glutathione conjugation pathway, and your antioxidation. Okay, so that's really where it has looked at, but there really aren't any widely accepted cardiometabolic vaccine injury SNPs. So these, when you're looking at this and talking about this and deciding how that information could inform you on future vaccines, you want to make sure to treat that as a background context. Always looking at any pre-existing issues, whether you have cardiovascular disease, any dysautonomia, POTS, if you have had previous vaccine adverse reactions, that also can play a major factor. So again, I know it can feel a bit overwhelming Um, but ultimately, it does come down to you. This is your health, your life, and it's up to you to make that final decision because nobody else should be making it for you unless you mentally or physically can't. But um, you know, take your agency back and make that decision for yourself. So,
Mhm.
Dr. Virkel, uh,
Okay.
are there any last uh, comments, um, information that you would like to share before we start jumping into the question and answers?
Yeah, just to reiterate, and you wrapped it up quite nicely there. Yeah, at the end of the day, your health is your responsibility. And at the end of the day, we want, you've heard the term a sound mind in a sound body. Well, you want an injection in a sound body as well. So you want to keep yourself, in as robust a health situation as you can, so that once you've gone through the process of deciding, okay, yeah, I've looked at my DNA, I've looked at my history, I've looked at the injection itself and what's in it and all these potential things. And yes, I think I need it, and I'm willing to if you mind me saying, take that risk. Then you have that deep down knowing inside that my health is sound, my immune system is as robust as it can be. I've done the things to prepare myself to receive this vaccination, and so we don't live in a world where there are guarantees, but from yourself you've done your due diligence and you've prepared the soil, if you will, to get as good response and minimize as much as you can in terms of adverse reaction for the benefit you're trying to achieve in getting that vaccine. So if you keep that in mind and approach it that way, then forevermore you have a sound plan, if you will, a sound system, if you will, to coming to a decision that's right for you.
Are there any more universal actions or things that people can do? Say someone has decided, yes, I feel that the benefits outweigh any risks to take a particular vaccine. Um, Obviously, we can't give specific recommendations because we don't know the person's genetics, we don't have their history or anything else like that. But do you have any more universal type recommendations for people to do to prepare their bodies to make sure that they have the best outcome going into having a vaccine, and then afterward what they can do to make sure that they recover or handle it the best way possible? Again, I know this is not personalized because we don't have their genetics, but
Yeah.
under the circumstances.
Okay. So yeah, let's look at life. Okay. Reality is there's a lot of stress in life. And stress affects us in various ways, and stress is going to affect your immune system. Okay. So, whatever decision you've made to get your vaccine, if it's that particular day you're going through a certain amount of stress, then you may say, well, this may be a good thing to do, but this may not be the day to do it. Um, Stress, okay? Stress affects your immune system. So, and most of these viruses, at least the ones we as adults take, relate to things like the flu, the COVID, those kinds of things, okay? So, I mentioned stress. Stress suppresses your immune system, and you want the whole idea is to have a robust immune system so you can get a robust response. So you may want to at least a few days before the vaccine do the things to give your immune system a boost that in your life experience have helped you. Um, let's talk about the flu vaccine. The flu vaccine is given in the fall. That's when we call the pharmacy and they tell us come get it. But in the fall, the temperature changes, and a temperature that's dropping is going to affect our immune system. So that alone should say, well, if I'm going to get my vaccine, then I need to do the things that I need to do to counteract the effect of the change in temperature. They've done studies where they do a swab, a nasal swab, let's say, and culture it, and they get a certain number of viruses on it. They drop the temperature a couple of degrees and repeat the nasal swab, and there are a whole lot more viruses in there. So if you understand that concept, then we make the adjustments with preparing ourselves, depending on the stresses of the day, depending on the changes in the weather, we factor in those kinds of things, then all of a sudden now we again stacking the deck in our favor to get a good response, one, and to minimize reactions, two. So those are at least some things that you can think about from a universal standpoint without getting specific.
Well, I definitely appreciate that. And again, I know it can be very difficult, to give certain recommendations, because again, we are really moving into and focused on personalized medicine. And so when we are talking to a group, it can be a little more difficult saying precisely what, but we as humans, there still are certain things that we can do to help have a more robust immune system, to be at our most optimal. So that being said, we've got some great questions. So we are going to dive in, and I'll kind of go back and forth and toss some to you. I'll answer some. Our first question is from Ariana. She said, a friend shared with me that her grandson at 1 year old stopped breathing and could not be resuscitated the day after he had 5 vaccines. Do you have any information as to how often this type of incidents occur? That is, first of all, a horrible situation, and I'm very sorry that that happened. As far as how often that occurs, that's really difficult to determine. And that is because of the tracking system. Like I said, theirs is the only tracking system that we have. And it, like I said, from Harvard Health System, they've said that it does not capture everything. I don't know what the numbers are offhand. That's something that you could always look into. But, unfortunately, it's not rare enough. If it happens to one, it's still too many.
Okay.
But
if you want me to add, over the years, I've seen, sadly, what we call SIDS, sudden infant death syndrome. Okay? And I've seen it under different circumstances. And so, not because after I drove by the blue building, I got a flat tire. Does that say blue buildings cause flat tires? Okay. So the vaccine may have had something to do with it. It may not have had something to do with it. It's difficult to say. I've never seen a SIDS situation like you describe in terms of immediately after vaccination, but I've seen over the years, I've dealt with SIDS situations. So it's hard to say if they're related. But again, if she got the vaccine, then we have to say they may have been. But there are no studies that I can give you to say how often that relation has happened in terms of a SIDS death to vaccinations.
so our next question is from Faye. How do we detox from vaccine damage? I'll give my little brief, but I would love to hear what any words of wisdom that you have, Dr. Burkle. When it comes from detoxing to vaccine damage, it's something I have worked with clients before, specifically on this. And this is where the personalized medicine comes in. This is where I like to see your genetics. I want to see your history. I want to see, your life, so we can actually minimize any more toxic load, lower stress. What are you currently doing? What can we incorporate that would work for you and support your genetics? Because there are a lot of things. For example, with a few patients, something, that seemed, I'm going to say this outside of like the typical making sure that your sleep is good. We look at sleep hygiene, we look at diet, we look at supporting detoxification pathways. But something even a little bit more so than that is they did what we call EBOO, extracorporeal blood oxygenation and ozonation. So actually cleaning their blood, and removing, any adverse or anything in there that shouldn't be, and then putting it back into the body. And for those clients that I've worked with that had that done, had benefits from it. Now, that was just one a little bit more extreme particular treatment that they utilized. But I also worked like the entire terrain, like what Dr. Burkle was saying, making sure that you have a strong immune system, again, through looking at the diet, the lifestyle, the sleep, your stress levels, all of these different things, they all play a part in your body's ability to repair. So your body is always in a healing state, but we have to give it the tools for it to do so. Dr. Burkle, did you have any comments, anything?
Sure, I can add. Yeah, I can add a few things. COVID specifically makes sense. Yeah, adverse reaction. You think of the spike protein. You think of clearing it out of the system. Then you want to be sure that your cleansing system, your liver, your lymphatics, the kinds of things, your kidneys, the kinds of things that help you cleanse, even through your skin, using saunas and so on, to clear things out of your system. If that happens, my suggestion always is find a practitioner in your area to work with you, because that way then you're not missing anything. Things are being monitored, and that at least you're following the system that they follow and the system that they're using to get results in terms of clearing the system from that particular item that's causing the adverse reaction. So the things that can be done is a matter of recognizing and then getting the special help you need in terms of approaching and in terms of getting it done.
Perfect. Thank you. All right. Our next question is from Diane. She said, I know 3 individuals who, after their first COVID vaccine, did not wake up the next morning. One was a third-year medical student, one was a researcher, and one was an older man. So 3 different age categories. Do you have any idea how genetics may have played a role in their deaths? So Diane, a lot of it would be, again, this is more so conjecture because I don't have their DNA. I don't know the details of their lives, but I'm going to go back to the areas of research. And I did put the papers that I had commented on about the GST genes, the glutathione conjugation pathway, when it comes to COVID-19 susceptibility outcome, how that worked, specifically looking at genes and that condition, as well as with methylation and looking at adverse reactions. There was another paper that I put in there. So again, I would suspect, and I'm just guessing, that there could have been something in their detox pathways. It could have been something if they had some underlying issues that were not present, and maybe taking the COVID vaccine pushed it over the edge. Okay. It's it's like having a dam with a crack. It's there, but it doesn't really become present until you have enough water, enough pressure pushing for that crack to then break. And then just that whole collapse of the dam. I'm so sorry about the loss of those 3 lives. Um, there's still a lot of work and research that is being done. And this is why we need to bring this information more forefront, more out into the public. So researchers are not afraid to do that research, to look in to see why and what's going on. So that way we can protect our population. Okay, so we have.
Let me just add a thought here, and I don't know. I don't mean to. Okay, so I have over the years, I have an approach to medicines, not necessarily vaccines. Okay, but there are continually new drugs coming out, and the drug people come around and they obviously educate us on those new drugs. Well, I had a personal policy that unless that drug's been out 5 years, I'm not going to give it to my patients. Okay, I'm just not. I don't care how good it is, how better it is. What I'm using is fine, thank you. When it's been out, and over the years, by the 3rd year, it's called off the market, and so I've saved my patients a lot of grief with that kind of thing. So, in terms of, and this is just a generalization. Um, Another thing you look at, how long has this been around? What do we know about it? How can I protect my health and make a good choice? This may not have been out long enough. All those things you factor in terms of making that decision. Um, so it's really not simple, and it's really okay. But if you have certain principles that you follow, certain steps, if you will, that you follow, then that too will help you make a decision. Because whatever we do, we want to make decisions on the side of safety, on the side of again, minimizing reactions and those kinds of things. So I didn't mean to confuse you with what I just said, but it's just a personal approach I've had through the years in terms of myself and in terms of the patients I take care of. Because at the end of the day, if you put your health in my hands, I think I need to do the best I can or whatever I think is appropriate to, as the physician oath says, do thy patient no harm.
And I'm sure your patients absolutely adore you for the work that you do and
Sure, sure, sure.
the care and safety that you provide to them.
Well, thank
So
you.
Deborah has our next question, and she's saying, can a vulnerable genetic profile like multiple GST null genotypes and MTHFR issues be used as a medical reason for an individual not to be vaccinated? As far as I know, right now, no. Um, Maybe when more research and it becomes more accepted for genetic susceptibility, possibly. But as of right now, no. But there are things. Okay, I'm going to share this that looking at what I was saying about if you have had previous issues, previous medical conditions. So remember, I had said on adverse reactions, I'm going to use COVID-19. So for the COVID-19 vaccinations, okay, they had possible adverse events included, Bell's palsy was one of them. Actually, it was one of the main ones. Thrombocytopenia. There were other adverse events that could happen. So not that you could use genetics, but if you have a previous history, for example, I've had Bell's palsy 3 times and it was before COVID. Okay. And so I spoke to my doctor because I was at the university. They were saying, hey, you need to get COVID-19 vaccine. And the thing is, it's like, I've already had Bell's palsy 3 times. I don't want to take that chance. So when I weighed out my risk to benefit ratio, to me, I felt it would be more of a risk. And the fact that I've had lower limb thrombosis before, and that was also a possible adverse event. So to me, based on my previous history, because I didn't know my genetics at the time, that was a better bet for me. So I did my homework. I brought him the scientific research. I brought him the adverse events, that inserts, the information. And I'm like, and so I didn't have to take it. But this is something each of you has to decide, has to do your homework, have to, look at. And again, hopefully there will be a point that there will be enough research of genetics and vaccines in Adversomics that we can start moving toward that if someone so chooses that route. Mm-hmm. All right, so our next question, or actually, let me see, is this a question or a comment? Let's go to a question. Crystal is asking, would this also possibly go hand in hand with the pharmacological report you all have as well? And what medication substrate might have more effect and stick around? Okay, so this is somewhat what Dr. Burkle was talking about before when he was talking about medications. And I had also mentioned when we're talking about inflammation, medication, are medications good for someone? Well, guess what? We actually have a specific test that can look at your genetics based on pharmaceutical drugs to see where you lie within that, and if those particular drugs would be warranted or possibly reconsidered with your prescribing doctor. And that is our PGX report, pharmacogenomics report. So our team will, Vanny can put that in the chat so you can take a look and see if this is something that you would like to invest in, to know what medications genetically would work better for you or may not work as well for you. Okay, let's see. Yes, is there a question that you...
My understanding of the question, a little different, but maybe not necessarily, in terms of, still doing the PGX and knowing all that, but knowing how that medication is affecting you in terms of your immune system response, in terms of all those things. Because if you know how it is, then maybe you may want to, with the advice of your doctor, stop it for a few days or something like that before going ahead with the vaccination. Again, all those are things, and thank you for the question, things to think about, because many times lots of things we don't think about in terms of helping us make the best decisions that we need to do. So yeah, that's something to look into and see, how is this going to affect my response, this medication, and what's the risk of holding off on it for a period of time, and what period of time is reasonable in terms of minimizing whatever potential risk there is being on that medication for what I'm going to do.
All right, thank you. Okay, so Allison has a few comments and questions. She says that she has long COVID, severe MCAS, and chronic fatigue syndrome after 3 COVID infections and 2 vaccines plus 2 boosters, all in a short time frame. Before she had COVID, she was extremely active and fit. And she's asking, should she consider herself vax injured? No other vaccines, flu or other, have been a problem. That's a great question. That's a tough one to say. That would also be something that you'd need to go to your doctor. And actually, you can do a VAERS report on COVID-19, but you can, excuse me, also report, file your own. But I mean, you could do, through your doctor, through the doctor who sets you up to either do the shot or depending on how you got it. But I would go to your general practitioner, let them know. But if they say, no, I'm not going to fill that out, there is a link that you can do to report a vaccine injury. Does that guarantee saying, yes, the vaccine caused these things? No, but it would at least start the ball rolling to get you more information and maybe even get you some help that you may need. Because again, it truly is about educating yourself, knowing where the resources are. So I just put in the link, a website for iCanDecide.org, where it's a report of vaccine injury. And what this does is that it allows you to fill out, to give the information, and it also gives you a link to file a VAERS report, because yes, you can actually file a VAERS report. You don't have to have a medical doctor do it. And then it goes into the system and does all the things. So that's really the most that I can say for you right now. Because she also, Dr. Burkle, and I can, if you want to chime in, I do want to mention that we cannot give any medical advice, because even though we're doctors, we are not your doctor, and we don't have your medical history. We don't have this information. So it's more or less giving you resources and education to be able to move forward, in your own health. The Allison also said that, she said, how do I know whether or not to get the shingles vaccine? She's had the long COVID, like we've said, but she recently had shingles on her scalp, and she's nervous about all of this. Do you have any general advice, beyond what we've already mentioned here tonight?
As far as the shingles vaccine, yes, each situation is different. Having had shingles doesn't necessarily preclude getting the shingles vaccine. Now, over the years, in my experience, if you've had shingles, it's very unusual to get it again. But that doesn't say you won't or you can't. So it's making that decision. Well, the shingles was so bad, I don't want to get it again. Let me stack the deck in my favor. I'll do everything I can to keep my immune system up. Because you get shingles in the first place because when your immune system is compromised for whatever reason. A stressful day, getting the flu, any stressful event in your life can lower the threshold for the herpes virus to reactivate. Makes sense? So if indeed you really don't want to deal with that again, then factor in the fact that you're stacking the deck in your favor. You're going to keep your immune system in tip-top shape as best you can, but then you have this additional help here so that will be that immune response should this happen again. And it'll happen again. Potential of happening again if your immune system is compromised, because usually that particular virus hides in the nodes. And when your immune system gets compromised, then it reactivates. It's like someone is guarding the door, and when your immune system is compromised, the guard at the door is taking a nap.
Exactly. And I mean, that's
So,
really with any latent viruses.
yeah.
We're not just talking about, the chickenpox, virus. We're also talking about like EBV, the cytomegalovirus, any of these, they don't totally leave your system. Your body encapsulates them. And when your immune system is compromised, when you are really stressed and it's just wary, like he said, that little sentry or that he's asleep, well, the viruses, they tend to get out and play. When the cat's away, the mice will play. And that's what that virus does. And then it can, incite your immune system and cause those symptoms, those problems. So lowering your stress load plays a huge part. And actually, this really works into our last question from Amy, who's a healthcare provider. She said she was never a fan of vaccines, felt like we have natural immune systems for a reason. Now she's disabled and injured from mandated COVID vaccine. She had no medical problems before. She was a runner, ate healthy. Now she's got lupus, myocarditis, myocardial fibrosis, POTS, neuropathy, neurocognitive issues, MCAS, and the list goes on. And she's asking us, in our experience, have we seen people reverse these issues with supporting methylation detox, eating gluten-free? And she does have 6 Gs of her 9p21 gene, so very, very sensitive of her endothelial lining. I'm going to answer my part first, and then I would love for you to chime in and let us know how you have dealt with this before. But again, I've mentioned before that I have dealt with people dealing with long COVID, dealing with COVID vaccine injury, symptoms very similar to your profile. And yes, I have seen them get better and reverse some of the issues. In totality, to be totally back to where they were, no, not quite. I only worked with them for about a year, and it takes a while, but they certainly felt much better. They went from not being able to walk across the house to being able to walk well, one of them like 5 miles, you know, being able to do things again, and reversing some of the severity of those symptoms. So, yes, it can happen. Exactly how that would look and what would need to be done, that would be based on obviously working with you, directly, knowing your full profile, knowing where your weaknesses are, where your strengths are, what needs to be done, what's your lifestyle, stress load, all of these different things. And I can certainly assume that your stress load has been very high, especially if you've been dealing with all that. And it absolutely breaks my heart that you've been having to deal with this, and you have my sympathies. So whatever we can do, if you are interested in working with me or one of our practitioners on this, Dr. Burkle is part of our team. Please reach out, and see if one of our programs would work well for you. Dr. Burkle,
Sure.
what have you?
Okay. So the thing I would say, yes, people do improve. Um, but where we get into trouble many times is we don't give things time. Okay. We get anxious, we feel bad, we want to be better tomorrow. Just a personal experience to put that in perspective in terms of what I just said. As a 5-year-old boy, I had congestive heart failure, and I found out in terms of the effect on me when I got to medical school and saw an electrocardiogram and a chest X-ray of myself. My heart was 3 times as big as all my friends. Now, some many years later, my heart is normal. But some 30 years ago, I decided I need to do something, began to look into what I needed to do to improve my situation, called cardiomegaly at the time. And I just systematically, it took maybe 10 years. Lots of people, after a while, would say, this is a waste of time. What am I doing? Give up. Makes sense. But since I only have one heart, I wasn't about to give up. And so, yes, things can be done. We just need to be patient. We just need to work with them. Everybody's different. Yeah, your journey to improving may not be like your neighbors or someone you read about or someone you heard about, but start the journey, stay on the road, and never give up. Even if you don't get to where you were before, get as good as you can get in terms of your health based on what you're dealing with. We are all different. How we were affected is all different. The degree to which we're affected is all different. How we respond to what's being done to us is all different. We just need to be consistent. We need to be persistent, and we need to give it time.
Well, thank you so much for that wonderful wealth of information, the wisdom, and the advice. We really thank you for being here tonight with
You're
us,
welcome.
Dr. Burkle. And I want to thank all of you for joining us tonight. I hope that you are walking away with some information, a feeling of empowerment to get more of that curiosity, to know more, to do more for yourself. So remember, have your agency, your life, your health, your decision. Just go into it being informed. We are going to be speaking more about this into the future. So please, watch out for our webinars, for upcoming information and new genes that we are incorporating into our reports. That some of them have already been uploaded. You can actually see them on the app, but we are going to have all of that information added into the new year. So with that, have a wonderful evening, everyone. And we look forward to seeing you next week. Well, actually, wait, today's Wednesday. No, I think we have one tomorrow. But I will see you next week and have a very happy holiday. Take care.